Are you a PMHNP in Texas? Avoid these costly billing and coding mistakes that could be draining your practice's revenue and putting your license at risk. I know how hard you work to provide incredible care for your patients, but the back end, the business side of things, can be a minefield. Simple administrative errors, things that seem small, can snowball into massive headaches. Denied claims, delayed payments, and worst of all, audits from insurance companies or even the state board. It's a stressful part of the job that we often don't get enough training on in school, but getting it right is absolutely critical for the health of your practice and your own peace of mind. That's why today we're diving deep into the most common and most damaging billing mistakes I see Texas PMHNPs make every single day. We're not just going to identify the problems, we're going to talk about practical, actionable solutions you can implement in your practice immediately. Think of this as a checkup for your clinic's financial health. We'll cover everything from simple data entry errors to complex Texas-specific regulations that you absolutely need to know. Stay tuned to learn the top errors, how to fix them, and boost your bottom line. By the end of this video, you'll have a clear roadmap to a more efficient, profitable, and compliant practice. Let's make sure you get paid for the vital work you do without the constant worry of claim rejections or compliance issues. Ready to protect your hard-earned income and your license? Let's get into it. And hey, if you find this helpful, which I know you will, do me a solid. Don't forget to like, share, and subscribe to Mind Matters Y6T for more essential tips. Alright, let's start with the basics, because honestly, this is where most of the preventable errors happen. It's the equivalent of forgetting to check a patient's vitals before an exam. It's foundational. I'm talking about incorrect or missing information on your claim forms. It seems so simple, right? A name, a date of birth, an insurance ID number, but a single typo, a transposed digit in a policy number, or an outdated address can bring the entire reimbursement process to a screeching halt. Insurance companies use automated systems to scan these claims, and the second that system finds a mismatch between what you submitted and what they have on file, it's an automatic rejection. No human review, no second thought, just denied. Think about the ripple effect of this. A denied claim doesn't just mean you have to resubmit it, it means your staff, or maybe you, has to spend precious time investigating what went wrong, tracking down the correct information, possibly contacting the patient who may not even know their details are outdated, and then going through the whole submission process again. That's time you're not spending on patient care or growing your practice. It's lost revenue that sits in limbo for weeks, sometimes months, wrecking your cash flow. So, my advice is simple but crucial. Double-check every single claim for accurate patient demographics, up-to-date insurance details, and correct provider credentials. Make it a non-negotiable step in your workflow. Implement a verification protocol. Before a new patient is even seen, have your front desk or your intake coordinator verify their insurance eligibility and benefits. For existing patients, make it a habit to confirm their information at every visit or at least every few months. Has your insurance or address changed since your last visit? It's a simple question that can save you a world of trouble. Train your team to be meticulous. Create checklists. Use your EHR's eligibility verification tools. Treat every piece of demographic and insurance data as if it's as critical as a clinical note, because when it comes to getting paid, it absolutely is. Now let's move into something a bit more complex, but equally if not more critical, coding errors. This is where a lot of PMHNPs get into hot water, and the consequences can be much more severe than just a denied claim. We're talking about CPT codes for the services you provide, and ICD-10 codes for the diagnoses. These codes are the language you use to communicate with insurance companies, telling them what you did and why you did it. If you're speaking the wrong language or using the wrong dialect, they're not going to understand, and they're certainly not going to pay. The world of coding is constantly changing, with updates, deletions, and new guidelines released annually. If you're using an outdated codebook or haven't kept up with the latest changes, you're guaranteed to run into problems. One of the biggest mistakes I see is a mismatch between the CPT and ICD-10 codes. Your diagnosis code must medically justify the service code you're billing for. You can't bill for a 60-minute complex psychotherapy session, CPT 90837, if the diagnosis is a simple, uncomplicated adjustment disorder that doesn't support that level of service intensity. This is a huge red flag for payers and a direct path to an audit. Another major issue is misusing modifiers. Modifiers provide crucial context to a service, like indicating a telehealth visit, or that two distinct services were performed on the same day. Forgetting a required modifier or using the wrong one is like leaving out a key ingredient in a recipe. The whole thing falls apart. And we have to talk about upcoding and unbundling. Upcoding is billing for a more complex and more expensive service than what was actually provided. Unbundling is billing separately for services that are typically included in a single comprehensive code. Both are considered fraud by insurance companies and federal regulators. So, how do you avoid these landmines? First, invest in continuous education. Attend webinars, subscribe to coding newsletters, and always have the most current CPT and ICD-10 code books. Second, be specific and accurate. Don't just default to the same few codes for every patient. Your coding should tell the specific story of that encounter. Third, when in doubt, get help. Consider hiring a certified coder or using a billing service that specializes in mental health. The cost of their expertise is often far less than the cost of a major audit, fines, or even the loss of your license. Remember, accurate coding isn't just about getting paid. It's about ethical practice and protecting yourself from serious legal and financial repercussions. If coding is the language you use to talk to payers, then your documentation is the evidence you present in court. It's your ultimate defense. You can have every code and modifier perfect, but if your clinical notes don't back it up, your claim is built on a house of cards. A payer can, at any time, request your records to justify a claim they've paid or are considering paying. This is called a retroactive audit, and it's happening more and more. If your notes are sloppy, incomplete, or don't clearly establish medical necessity, the insurance company can demand you pay back the money they've already sent you. This is known as a clawback, and it can be financially devastating for a practice. So what does good documentation look like? It needs to paint a clear picture. Your notes must explicitly state why the service was medically necessary. This means documenting the patient's symptoms, functional impairments, and the specific reasons they require your level of care. It's not enough to write "patient depressed." You need to document the severity, the duration, the impact on their daily life, their job, their relationships, their self-care. You also need to clearly articulate your treatment goals. What are you working towards with this patient? How will you measure progress? Payers want to see a plan. They want to know their money is funding a structured, goal-oriented therapeutic process. Finally, the nuts and bolts have to be there. For any timed service like psychotherapy, you must document the exact start and stop times, not an estimate, the actual times. 45-minute session isn't enough. It needs to be 1:05 p.m. to 1:50 p.m. This seems tedious, but it's a critical detail that auditors look for. Your notes should be signed and dated for the day of service. Incomplete notes are one of the biggest red flags for payers, and can lead to automatic denials or trigger a much deeper, more stressful audit. Think of your documentation not as a chore, but as your most powerful tool for protecting your revenue and your practice. Make your notes so clear and comprehensive that anyone, an auditor, another provider, or a lawyer, can understand exactly what you did, why you did it, and why it was necessary. Let's talk about two of the most frustrating time-sensitive hurdles in the billing world: prior authorizations and filing deadlines. These are the administrative gatekeepers that can slam the door on your reimbursement before you even get a chance to make your case with coding or documentation. A prior authorization, or pre-authorization, is the process of getting approval from a payer before you provide a specific service. Many insurance plans require this for things like psychotherapy, psychological testing, or certain medications. If you provide that service without getting the required auth, the insurance company has no obligation to pay for it. Period. It's an automatic, irreversible denial. The burden of securing this authorization falls squarely on you, the provider. It involves contacting the insurance company, providing clinical information to justify the need for the service, and getting a specific authorization number. This can be a time-consuming, frustrating process of phone calls, faxes, and online portals, but skipping it is not an option. You absolutely must have a system in place to check for prior authorization requirements for every patient and every service. This should be part of your initial benefits verification process. If an auth is needed, you have to get it secured before that patient's appointment. Failing to do so is like giving away your services for free. Just as critical are the filing deadlines. Every single insurance payer has a timely filing limit, which is the window of time you have to submit a claim after the date of service. This can vary wildly from payer to payer. Some might give you a full year, but many, especially commercial plans, might have a deadline of 90 days or even 60 days. If your claim arrives one day after that deadline, it will be denied for timely filing, and there is almost no appeal for this. It's a hard and fast rule. This is why you cannot let claims pile up. You need a streamlined process to get claims submitted quickly and efficiently after each session. Missing these deadlines is literally leaving money on the table, money you have already earned. Okay, let's zoom in and talk specifically about practicing in Texas, because our state has its own unique set of rules that you absolutely must follow. These aren't just insurance company policies, these are state laws and regulations governed by the Texas Board of Nursing. Violating them can have consequences far beyond denied claims, potentially putting your PMHNP license in jeopardy. First and foremost is the Prescriptive Authority Agreement, or PAA. As a PMHNP in Texas, you must have a signed PAA with a supervising physician to prescribe medications. This isn't just a piece of paper you sign once and forget about. It needs to be maintained, reviewed annually, and readily available for inspection. Make sure it's current and accurately reflects your practice and your collaboration with your physician. Next, you have to be vigilant about practicing within your scope. As a PMHNP, your scope is focused on mental and behavioral health. Be cautious about managing complex medical conditions that fall outside of this specialty. While you treat the whole person, it's crucial to document collaboration with primary care physicians or other specialists for comorbid medical issues. This not only ensures the best patient care, but also protects you from allegations of practicing outside your scope, which is a serious charge. The Texas Board of Nursing takes this very seriously, and clear boundaries and documentation are your best protection. Finally, let's touch on a major financial and legal issue in Texas balance billing. The state has enacted strong consumer protections against surprise medical bills, particularly with laws like Senate Bill 1264 and HB 300. You need to be extremely careful about how you handle out-of-network billing and how you communicate financial responsibility to your patients. You must provide clear, upfront disclosures about your network status and the potential costs. Improperly balanced billing a patient can lead to significant fines and sanctions. Navigating these Texas-specific rules is non-negotiable. It's about more than just getting paid, it's about maintaining your professional standing, your reputation, and your legal right to practice in the Lone Star State. The rise of telehealth has been a game-changer for mental health access, but it's also opened up a whole new category of billing and coding errors. You can't just conduct a video session and bill it the same way you would an in-person visit. Payers have very specific rules for telehealth, and they're watching these claims closely. The most common mistake is using the wrong codes. To get paid for a telehealth service, you almost always need to add a specific modifier to your CPT code. The most common one is modifier 95, which indicates a synchronous audiovisual service. But some payers might require a different modifier like GT. Using the wrong one or forgetting it entirely is a surefire way to get your claim denied. Another critical piece is the place of service, or POS code. For a long time, the standard was POS 02 for telehealth. However, during and after the public health emergency, the rules changed. Now, for many payers, you're instructed to use the POS code that reflects where you, the provider, are located, for example, POS 11 for your office, and simply add the telehealth modifier. This is confusing, and it varies by payer. You absolutely must verify the correct POS code for each insurance plan you bill. Getting this wrong can lead to denials or even worse, accusations of fraudulent billing if it appears you're misrepresenting where the service occurred. Finally, never assume that a service covered in person is automatically covered via telehealth. While coverage has expanded dramatically, some plans still have restrictions or require a separate prior authorization for virtual care. Always check the payer's specific telehealth policy before you bill for a virtual visit. Are they covering audio-only sessions? Do they have specific documentation requirements for telehealth? These policies are constantly evolving. Telehealth is an incredible tool that allows us to reach more patients than ever before, but that convenience is only sustainable if you get the billing right and ensure you are getting paid for your vital work. So there you have it. The top billing and coding mistakes that can trip up even the most dedicated PMHNPs in Texas. We've covered everything from the simple yet costly data entry errors to the complex state-specific rules you need to have on your radar. I know this can feel overwhelming. It's a lot to manage on top of the already demanding work of providing mental health care. But think of it this way: mastering your billing isn't just about money, it's about stability. It's about creating a sustainable practice where you can focus on what you do best, helping your patients, without the constant nagging stress of financial uncertainty or compliance fears. By implementing the strategies we talked about today, double-checking information, staying current on codes, writing bulletproof documentation, and minding your deadlines and Texas-specific rules, you are building a stronger, more resilient practice. You're protecting your revenue, your license, and your professional reputation. These small, consistent efforts will pay huge dividends in the long run, giving you the peace of mind and the financial health to continue doing this incredibly important work for years to come. You deserve to be compensated fairly and promptly for your expertise. Ready to keep learning and growing? Want more tips to keep your practice profitable and compliant? Like, share, and subscribe to Mind Matters E6T for the latest updates in mental health billing and coding. This is a community, and we're all navigating this complex landscape together. If you have any questions about what we discussed today, or if you have a billing challenge you're facing, please share it. Drop your questions in the comments. Let's help each other succeed. Thanks for watching, and I'll see you in the next video.